Yeah, I think something that's probably very important is where a patient, I think this is what it's boiled down to. I've thought about this a lot. I think a patient needs to feel heard. Like when they go and they see the doctor, they need to feel like, yes, they understand I want to keep my leg, or they understand I'm sick of having had all these procedures. Whatever it is, they need to feel heard, and they need to feel like the doctor is going to do everything they can to achieve that outcome. So, like I've met the rare patient who say to me, "Oh, look, I've been with this other doctor. I've had these many procedures. I'm sick of it. What can you do to stop me having procedures?" And that's a very different conversation to someone who's saying to me, "Hey, this doctor has said they're going to chop off my leg. Please just keep the leg attached to me." And I think most there are some doctors who won't listen. They won't, and they'll just do whatever they'll look down their nose at patients, and they'll do whatever the hell they think is right to achieve an outcome that the patient doesn't necessarily want. And I think that's where amputations and all these things come into it, where patients feel they're getting a solution that they didn't actually want or ask for. I think that's the most important thing. And in Australia, we all have the ability to choose. So I think if a patient sees a doctor and feels that that what they want isn't being enacted, they should go somewhere else.
Is there a policy? Is there a protocol? Do you have a certain place that patients can go to within facilities to make sure to not necessarily file a complaint, but if they can't, if their primary care says, "Hey, I'm only sending you to this doctor. The referral's only going there. I'm not sending you anywhere else." What do they have to do? Is there any way that they can have that choice to go somewhere else in a public system like that?
Yeah, so that's probably, we don't do this part very well. You do have the right to a second opinion, but a lot of patients, I mean, in Australia, I don't think our patients are as empowered as the US, where, there's advertising and, people are, it's front and center that you can go get a second opinion. I think in Australia, a lot of patients still kind of look at the doctor and say, "Well, oh, he said whatever, that's what's going to happen." But it's very simple. I mean, you can just, if you're a patient and you're not happy, you just Google it, and a whole bunch of other doctors in the area will come up, and you can use that then to find a doctor for a second opinion. You don't even need a referral from the GP, technically speaking. You can just go and see them. Yeah, the referral is so that Medicare will pay for the consult, but you can pay yourself for the consult with the doctor and then get the referral later on. So yeah, but we don't do it very well. But yeah, certainly you can get a second opinion if your GP is not referring you or has referred you to someone that you don't like. Get a second opinion. There is certainly no harm. I have patients of my own who go and get a second opinion, and it's great because they'll then at least they're getting heard. If I haven't heard them correctly, maybe someone else will.